Safe handling of oxidizers. Oxidizers or oxidizing agents present fire and explosion hazards on contact with combustible materials by supplying the extra oxygen molecules, acting as a fuel, from its chemical makeup. Depending on the class, an oxidizing material may increase the burning rate of the combustible it comes in contact with, can cause the ignition of combustibles it may come in contact with, or undergo an explosive reaction when exposed to heat, shock, or friction. Strong oxidizers, such as peroxides, should be kept free from contamination, as a small amount of a contaminant introduced to its container can cause a spontaneous chemical breakdown reaction to start. It can extremely accelerate decomposition, creating a very unstable and hazardous situation. Oxidizers are also generally corrosive. Some common chemical oxidizer names are chlorates, chlorites, hypochlorites, nitrates, nitrites, and peroxides. Store oxidizers away from flammables, heat sources, organic material and compounds, and combustibles. Keep away from reducing agents such as zinc metal, alkaline metals, such as sodium or potassium hydroxides, and organic acids. Oxidizers should be stored in a cool, dry place with some ventilation as needed. Keep out of direct sunlight. Some containers may be shipped with vented caps or bungs. Never stack containers with vented bungs, as they may require breathing room to avoid a buildup of pressure inside the container. All oxidizers should be stored on plastic pallets. Wood pellets that get contaminated with an oxidizer can cause a fire if not rinsed clean. Some oxidizers, such as nitric and sulfuric acid, can easily fume or release a gas or vapor into the air. These fumes can be very irritating. Fumes from chlorine gas and hydrogen peroxide vapors can also act as irritant gases. All irritant gases can cause acute inflammation in the surface layer of tissues when in direct contact. They can also cause inflammation of upper airways, eyes, and throat and lungs. Some, such as fluorine or peroxide, can cause severe burns of the mucous membranes and skin. First aid for exposures to skin or eyes is to flush immediately with cold water for at least 15 minutes and seek medical attention as soon as possible. First aid for exposures to nose, throat, or lungs is to remove immediately to fresh air and to seek medical attention as soon as possible. Suggested protective equipment to use when handling this material is safety glasses or tight-fitting goggles if splash hazard potential exists, and neoprene or nitrile gloves. Protective clothing such as aprons or suits may also be used to prevent contact with clothing or skin. Exposed clothing should be rinsed with cold water upon removal. Always use chemicals in a well-ventilated area. As always, refer to the product SDS to learn more specific information about the product or chemical, and to find out what is recommended to best protect yourself from its hazards.